Inspire hope, promote wellness. This is Compass Points. Hi, this is Dr. Paul Tomlinson from Compass Health Network. On this show, I'll share ideas, hacks, tips, and skills drawn from research in the behavioral and health sciences. You can think of Compass Points as navigation assistance for the path to better health and wellness. So let's get to the Compass Point.
We often talk about housing as a social issue, or a policy issue, or an economic issue, and all of that's true. But housing is also one of the most powerful health interventions we have. You may not have thought about it that way. But it's something our 2025 Community Health Needs Assessment made very clear. Across the communities we serve, housing instability shows up again and again alongside mental health challenges, substance use, and chronic medical conditions. These aren't issues that are just correlated, they're actually deeply connected. Because here's the reality, if you don't know where you're sleeping tonight, it's almost impossible to focus on getting better, on recovering, right? If you're worried about whether you'll have a place to stay, that sort of thing, it's hard to keep therapy appointments, for example. It's hard to take medications consistently. It's hard to manage diabetes, depression, or anxiety when your energy is going toward basic survival, and you're living in Maslow's basement, as we say sometimes. If you're living in a car, a tent, or bouncing from couch to couch, everyday needs like food, hygiene, privacy, safety, they become daily obstacles. And when those needs aren't met, health almost always suffers. How could it not? So housing isn't a luxury. It's one of the platforms on which recovery stands. That's where supportive housing and other related programs like the ones Compass provides come into play. Supportive housing isn't just about providing a roof over someone's head. It's about pairing stable housing with the services people need to address the underlying issues that contributed to the instability in the first place. Now, that might include case management, peer support, mental health and substance use treatment, etc. Help finding employment, life skills coaching. Sometimes it's help navigating benefits. Sometimes it's simply having someone walk alongside you as you rebuild routines and rebuild your confidence. When housing and services are linked and integrated, something important happens. People can move out of survival mode. And that's essential. So instead of constantly reacting to crisis, they can begin to plan. Instead of just getting through the day, they can start to imagine a better future and build that future. Stability creates space for healing. So one thing our needs assessment also highlighted is that homelessness doesn't always look the way people expect, especially in Missouri. In many communities, homelessness is hidden. It might look like doubling up with family members, sleeping in a broken down vehicle, or staying in overcrowded or substandard housing that isn't truly safe or stable. We heard stories like that again and again in our needs assessment process. Now, these situations still carry significant health risks, particularly for people living with chronic illnesses, serious mental illness, and substance use disorders. So the stress alone, constant uncertainty, lack of rest, lack of control, takes a real toll on both physical and mental health. So when we talk about housing, we're not just talking about those we see on the streets, for example. We're talking about a much broader group of people who are one unexpected expense, one illness, one crisis away from losing stability altogether. And here's the part that sometimes gets overlooked. When we invest in housing, we don't just solve a practical problem. We restore dignity. Having a place of your own means privacy, it means rest, it means safety, it means being able to close the door, take a breath, and exist without constant fear or disruption. Those things matter a lot. People who have a space they can call their own are far more likely and able to stabilize their health, reconnect with loved ones, engage in treatment, and rebuild a sense of purpose. Hope becomes possible again, not as some abstract idea, but as something grounded in daily life. That's why we say housing is healthcare. So if we want healthier communities, we can't treat housing as an afterthought or an optional add-on. It has to be part of the strategy, part of the system, part of how we think about prevention, treatment, and recovery. The Compass Needs Assessment helps make this visible. It connects the dots between housing, health outcomes, and long-term community well-being. And it challenges us to think bigger about partnerships, investments, and solutions that meet people where they are. As we continue this podcast series, Compass Points, we'll keep exploring how the needs identified in our communities are shaping the work ahead. Housing is one piece of the picture, but it's a foundational one. Because when people have a stable place to live, everything else has a better chance to follow.